The term Person-Centered Care, or PCC, has become prevalent in discussions of patient care and nursing practice. It is defined by McCormick and McCann as an approach to practice that is established through the formation and fostering of therapeutic relationships. Although there are many factors that constitute optimal person-centered care, majority of care occurs through the direct interactions of the nurse and the patient. The Person-Centered Care framework was created by McCormick and McCann for the intervention stage of a large quasi-experimental project that focuses on measuring the effectiveness of implementing of person-centered care or nursing in tertiary hospital settings. Today we will be focusing on nurse-patient interactions, person-centered communication, the nurse activities and processes that form person-centered care, and how they relate to the PCC framework. Australian Commission of Safety and Quality in the Healthcare defines person-centered care as being respectful to and responsive to preferences, needs and values of the patients and consumers. They also identify respect, emotional support, physical comfort, informing and communicating involving the family and the carers as a paramount to person-centered care. Person-centered care was developed to increase the awareness of the patient as an individual. Person-centered care focuses on a range of activities of care which is delivered through the PCC framework, which includes working with the beliefs and values of the patient, acknowledging and engaging with the patient and their family. This includes prioritizing the receiver of care by involving shared decision-making, making self available for patients' concerns, and assisting them with their physical needs. These are important components for developing a higher quality of healthcare. PCC needs to be highly prioritized and utilized not only as a way of thinking about the patients, but be as a guide to actions of nurses, including health and social services that enhance patient care. This is of equal importance with planning, developing, and monitoring care and ensuring the needs of the patients are met. According to interviews conducted with English nurses, some of such processes include understanding the person and their identity, including their routine, as well as communicating with the families. This was done to build trusting relationships between the patients and the nurses. Focusing on the values, the patient was recognized by nurses as making a difference in care provided. Activities such as taking a patient for a walk or having a short conversation were recognized by nurses as being important in facilitating PCC.
From the receivers of care perspective, some of the major themes that emerge as being key in experiencing PCC included being recognized as an individual rather than a set of medical problems. This was achieved by nurses addressing the patient by their names, offering the patients privacy, and nurses talking to patients to get a better understanding of their concerns. Having personal wishes being taken onto account was important for the patients. This was achieved by nursing listening to the patients, understanding and responding to their needs when the patients were in a vulnerable position. It is important to recognize that the focus of person-centered care consists of more than simply complying with patients' requests and providing information. Person-centered care focuses on considering patients' desires, values, family situations, social circumstances, and lifestyles, and working together to develop appropriate solutions that are vital in providing person-centered care. Seeing the person as an individual beyond the concept of the patient and putting them at the center of care is the very essence of person-centered nursing. Being compassionate, thinking from the patient's point of view, and being respectful are important factors and can assist in sharing decisions with patients and helping people manage their health. It also allows for other health professionals and healthcare teams to embrace person-centered care, making working as a collaborative care easier. However, person-centered care is more complex and encompasses more aspects than those listed. Another framework which was developed for nursing patients in an aged care facility involves nursing taking active steps to ensure individualized approach. These include the nurse getting familiarized with individual aspects of the patients, such as their strengths and weaknesses, likes, dislikes, personal preferences in routines, as well as being alert to the changes in the patient. It's important to recognize that all patients are different, as well as that their needs and preferences change. This means that nurses must continuously find individualized approach to each patient. This entails engaging with the patient and inquiring about what is best for them in their care, according to their beliefs and values, which are the core aspects of person-centered care.
While the information previously mentioned is a general guideline, you might be wondering how it's applied in a real clinical setting. Here's a Feeny example. In October of 2007, Ryan Saunders was misdiagnosed by his local GP and later by a regional Queensland hospital. Ryan tragically passed away from the undiagnosed bacterial infection that led to toxic shock syndrome. During the time of his illness, Ryan's parents had concerns about their son's great level of pain and stated that this was not a normal virus. Despite their efforts, their concerns were not properly acknowledged by the health team, and sadly Ryan passed away. He was only 2 years old. After investigations by Queensland Health, Quality and Complaints Commission, the Medical Board of Australia and the coroner, Ryan's Rule was born and has been implemented across 164 hospitals and health services in Queensland. Ryan's Rule enables clients and their families to have a formal voice if they are not satisfied with the care them or their loved ones receive. Here is a brief explanation on how you access Ryan's Rule. The first step is to talk to the nurse about your concerns, and if you are not satisfied with the response, ask to talk to the nurse in charge. If you're not satisfied with the response, phone 1300-HEALTH or ask the nurse to call on your behalf and request a Ryan's Rule clinical review and provide the following information: hospital's name, your name, ward, bed number, and your contact details. A Ryan's Rule nurse or doctor will review the patient and assist. Ryan's Rule can often be seen as somewhat of a threat towards health workers. However, Ryan's Rule's purpose is to support person-centered care and each of its key principles. It allows patients and their families to reach out and seek help concerning the care they receive, as well as working with their values and beliefs regarding their health needs that they may feel are not being met. If the current health team does not successfully follow up with those concerns, a doctor or nurse from Ryan's Rule team will reach out and follow up with the situation and provide a resolution, all while having a sympathetic presence and approach. Ryan's Rule also ensures that each person is dealt with as a unique case, and all aspects of a person, including physical, emotional, and spiritual, are taken into consideration, also known as holistic care. The process will also reinforce that medical staff take a step back and take the time to listen to the concerns that the person expresses. This will often lead to shared decision-making between the person, the health team, and their family, ensuring that they're giving all the significant information prior to any decision-making. Ryan's Rule ensures that all the correct steps are taken towards resolution, the concern is properly dealt with and resolved, and the patient, their family, and all carers are satisfied with the level of care and response they have received. This will hopefully lead to the 4 outcomes that person-centered care wishes to obtain. 1 is the person is satisfied with the quality of care. 2 is the person and their families are involved with the care. 3 is increased likelihood of improvement to the person's health. And 4 is reinforces therapeutic culture in the healthcare system.